Very much. It's great to see so many people here. I sure enjoyed the bananas, didn't you? And I sure enjoyed the grannies. You know, Ralph Klein used to talk about the grannies in the legislature all the time. He sort of was obsessed about them. He seemed to think that he seemed to be traumatized by a group of little old ladies wearing flowery hats singing rude songs about him. We got a lot of people here. We got any nurses here? Have we got any other healthcare professionals here? Have we got any senior citizens here? Have we got any kids here? And there's some people from Calgary. Well, we're all here then. Let's get on with it. You know, here we go again, folks. Once more, we have to fight to defend our birthright, which is our public health care system. You know, it bothers me that we keep having to do this, but you know what? I think we learned a lot back when Ralph Klein introduced the third wave. Because he went and tried to introduce a private two-tier healthcare system that the people of Alberta rejected. Iris Ellis was the health minister, and she went around the province talking to people, and I followed her around the province. And people were mad, and they let the government know it. They let the government know that they don't want private health care. And you know what? We stopped them once, and we should sure as hell stop them again. That's why, when poll after poll shows Canadians, and that includes Albertans, are solidly in favor of saving our public health care system. And why the politicians keep trying to change that. It doesn't make sense. But when you think about it, we spend $11 billion a year on health care in Alberta, and across Canada it's probably 10 times as much. And there's just a whole bunch of big corporations that just drool over that money, and they want that money to come from them before we get a single healthcare service. They just can't, they're beside themselves, looking at all of that public money not being spent on them. So the big insurance companies, the big healthcare providing companies, the nursing home companies, and especially the drug companies, put relentless pressure on governments right across Canada to do exactly what this government keeps trying to do. Unfortunately, the people of this country and the people of this province are wise to them. And they have stood up time and again to protect our public health care system, and that is why we're here today, to do it one more time. There's one person's name that keeps coming up as I think about it when we're dealing with health care in Alberta, and that person's name is Don Mazenkowski. Now, you may remember him as the Deputy Prime Minister in the most corrupt government in modern Canadian history, the Mulroney government. But he's also on the board of a number of corporations, including a major insurance company in this country. And he was asked by Ralph Klein to come up with a report on the future of healthcare. Now, a couple other things you should know about Don Mazenkowski, other than his name is on the front of an empty hospital that the government built. And that is that he's the political mentor of one Ed Stellman. So when our premier appointed Rockin' Ronnie Leipert as the Minister of Health, he said, here's Mazenkowski's report, you implement it. And that is exactly what Leipert is doing. He's not talking about what he's doing. One of the things they learned about the third wave is that you shouldn't have public participation. You shouldn't let the public know what's going on because they'll stand up and stop you. So this time, they're keeping their plans very close to their chest, and they're just bringing out one piece at a time. You know, they'll delist some healthcare services, and they'll privatize something, they'll get rid of health boards, and they don't tell them in advance what they're doing. It makes it more difficult to stop them. But my friends, stop them we will. things that I want to remember about the Mazankowski report, because it'll be a little roadmap to what Rock and Ronnie's up to with his healthcare privatization. He had 3 significant recommendations. And the first one was, guess what? Delisting of services. Reduce the number of things that are covered by healthcare. The second thing was to increase the amount of private delivery. And the third thing was, and we've got to wait for this one because it's still coming, more user fees. So that's the agenda. And this government is going to try and ram down the throats of Albertans one more time. And one more time, we're going to stop it, we're going to stop them, and we're going to protect and strengthen our healthcare system. I want to thank all of you for coming today. I want to thank the Friends of Medicare.